Heidi, is she back on yet?
I don't think Brenda's back on, but I can go ahead and start sharing my screen and start.
Yeah, why don't you go ahead and I'll figure out the difficulties here, technical difficulties.
Okay.
Thank you.
Okay.
Is Brenda back on?
Happened. Oh, I see.
I know she lost internet for a minute. Sorry, it took me a bit to get on.
Can you hear me?
I can hear you, Brenda.
Okay, I'm trying to get connected. Of course, my internet went out right when we were getting ready to start.
Of course.
Brenda, I'm sharing my screen and I can start if you would like me to.
Yeah, go ahead.
Okay, thanks, Brenda. I just wanted to say welcome to everyone. My name is Heidi Hotvedt, and I'm with Healthy Childcare, or I'm the Healthy Childcare Iowa coordinator for Iowa Department of Public Health. And I appreciate that Childcare Resource and Referral reached out to me, and that Brenda had asked if I would be willing to provide some information. We have a guidance document that's just been posted, and I was going to share some information about that, and then also wanted to just share some resources that are available for COVID-19. I just want to say I appreciate so much all of the hard work that our child care providers have been providing to keep families and children safe. You all do such a wonderful job working through all of the challenges that we're having right now, and I appreciate your commitment to providing the quality of care that you provide to children and keeping everyone safe. So I just wanted to say thank you so much for all of that you are doing, because this is a really stressful time. Unfortunately, with everything that's been going on with the number of cases that we've had in the state, it's a lot of changes, and it's rapid, and it is affecting everybody on a personal level, professional level. So I just want to again say thank you for all that you're doing. At Iowa Department of Public Health, we have a lot of resources related to really on the health and safety side of COVID-19. And I wanted to share a new guidance document that was just posted actually yesterday, and it was something that was worked on between Iowa Department of Public Health with some guidance, some information taken from the CDC guidance that was sent out, and then also working with our partners with Department of Human Services to come out with some guidance specifically around short-term closure. So what I'm sharing my screen right now, and hopefully everyone can see that, is the guidance document. And I'm just going to go through a little bit of the guidance document so you can see that. So the question that we were receiving, both the local nurse consultants and the state Department of Public Health, is there's those questions about, when would a child care provider decide to close, or if they were closed, what was the procedure for closing, and a lot of those kinds of questions. And so we looked at what is Iowa Department of Public Health's role, and then also what is DHS in terms of regulatory's role, and then what is the guidance from the Centers for Disease Control. So just so you understand, it is a decision by the child care program to decide about being open, or if they need to do a closure. Now, if there was, there's 3 instances when a short-term closure could be implemented, and that would be something that you would be directed to close and would be told the length of the closure. And that would be under a statewide child care closure, which would be the governor's proclamation. Similar to what has happened recently with governor's proclamations were related to maybe closing restaurants and bars and some of the other establishments, hair salons, some of the other things. So there's a proclamation, and then that was decided at the state level that there would be a closure that would be put into effect. That has not happened for childcare because although childcare workers are not listed as essential workers. I think you're essential. I think you should be listed as essential workers. But the reality is that essential workers is as a definition that is used for those frontline law enforcement and medical personnel and such. But you are as an essential service, and so that the governor has been very clear. If you've had the opportunity to watch some of her information that she has provided, she is very committed to keeping childcare open, because we do need children to have a safe place to go for care, and parents that are essential workers need to be able to work. The other circumstance where maybe a child care provider, either a center or home, would be asked to close or directed to close would be under a local public health order. So local public health might make a decision at a local level that there was a need for closure. That has happened. Actually, we had that. I know one county that did make that decision, and that is a decision that's made by the local public health and the health board for the community. So that order would come out, and then child care would need to have that temporary closure and would be directed to close and for the length of time that they would remain closed. And then there also might be a local public health recommendation due to community spread. So not an actual order that was written legally, but there may be a recommendation would be sent out from local public health saying that due to community spread that they needed child care programs to temporarily close. So those are the three situations where you would be directed. And then of course, Department of Human Services ultimately has regulatory authority. So Department of Human Services, and I didn't include that here, but that would be, and also where that would be a direction from Department of Human Services. And that would probably go under that governor's proclamation, to be honest with you. So the other types of situations where we keep getting questions about, and I'm just going to scroll up on this guidance document, is related to when would a child care program determine it's in your best interest to implement a short-term closure? And that's a difficult situation and a difficult decision, because not all situations are the same. And so we just have some guidance that's really related to some recommendations by the Centers for Disease and Control and the Iowa Department of Public Health. So just a little bit of information of how you would, what do you need to know in terms to make that decision. And so we always, say kind of an infected person has been in the child care facility. So when we say infected person, we're talking about someone who's either been tested and has been positively tested for COVID-19. So they were tested and they got the test results back and they were positive. So say that was a child or staff, or a visitor that was in your building for a period of time, and you found that out as a child care provider or director. Or if an infected person, child, staff, or visitor had symptoms of COVID-19, which would include cough, fever, shortness of breath, and that person had those symptoms and were self-isolating or being told to self-isolate because they maybe didn't have the test results back, or they didn't qualify to be tested because they don't meet the criteria. But that infected person has those symptoms of COVID-19. And then the other guidance to kind of help make that decision is a child or staff lives with someone who is positive for COVID-19 or has symptoms of COVID-19. So they've either been tested or they have symptoms, and they've been directed by their healthcare provider or public health to self-isolate. And we have a lot of that going on in the state where somebody maybe isn't tested for COVID-19, but there's a presumption that they possibly have COVID-19, and they will be directed to self-isolate, and then they will direct everyone in the household to self-isolate. So when you would have these situations come up, then that meets the criteria that Centers for Disease Control and the Iowa Department of Public Health would recommend in terms of implementing a short-term closure. So what's that process? And I'm going to talk about that a little bit. So, you're going to notify local public health. And on this guidance document, if you're not sure who your local public health office is, there is a map that you can link from this document. And you would just want them to know that you're implementing a short-term closure and why. And it's really just to alert them to the decision that you have made, and they might need that information for if there's some other community situations that are going on that they're trying to do some tracking. This would be another option for them to add to kind of their list of, okay, now we have this child care program that's going to close because of this reason. And so they would be tracking that. And so that's why you would want to notify local public health. So you're going to close the facility for 2 to 5 days for children and some staff. And it might be all staff, but some staff for sure. And this is what CDC recommends. And that during this short-term closure, this 2 to 5 days, it allows time for local health officials to gain a better understanding of the COVID-19 situation that is specific to your community and your child care program. You may be needing to close longer than 2 to 5 days, but this short-term closure will give you that opportunity to let public health know that you have decided to close and why, and then also to get some direction from them if there's a possibility that you would need to close for a longer period of time. You're going to want to communicate with staff and family. And we say, follow your emergency preparedness communication plan in terms of how do you communicate. But this would be kind of your communication would be your posting. So you're providing some information for staff and families about the COVID-19, and then you're maintaining confidentiality at all times and not sharing the reason that you're decided to close, but that there was a concern and you've decided to do a short-term closure, and you're communicating with local public health. And that's kind of the basic guidelines in terms of implementing that short-term closure. Some additional information that's on this handout, and then also, of course, when closing, and you all know this, you do also report to DHS that there's a reporting closure process for you, and you would follow that because you're doing a short-term closure. In the guidance document, we provide some information about what to do during when you're closed in terms of cleaning and disinfecting. And so there's some different information on there about that. And then also to contact your local nurse consultant for information on health policies, some disinfecting, cleaning questions, those kinds of things were available for that. And then there's some, at the end of the document, I just wanted to talk a little bit about, can you stay open, with some staff? And so, the children are not present, but, I've had this question come up a lot, where we've done a short-term closure, we're going to be closed for the next, we're going to be closed, the rest of this week and the weekend, and then we're going to evaluate if we're going to open back up on Monday, and I have some paperwork to do, and as a director, I need to do some figuring out with my staff and what to do. And so this is just some information that what you're doing during that temporary closure, that you want to continue to make sure that you're going to stop and slow any further spread of the potential for disease, and that if you do decide to stay open while children are staying home, for some staff members, that you should make sure that you're putting into place those social distancing practicing, making sure you're monitoring temps for your staff, making sure you're washing your hands, those protective things that we've been talking about for a long time, about hand washing and with soap and water for 20 seconds. If you don't have water available, to do hand sanitizer, to avoid touching your eyes, nose, and mouth with unwashed hands, avoiding close contact with people who are sick, staying home when sick. That is probably the biggest thing that I could really suggest as a public health nurse, is, if you're ill, if a child's ill, if a staff person's ill, they should stay home. And then making sure you're covering your mouth when you cough or sneeze, and then cleaning and disinfecting frequently touched surfaces. So that's just an overview of this document. And like I said, this was just posted. I'm going to show you on our website where this is posted. And let me just switch screens real quick. So on our, I think most of you probably are familiar with the Healthy Childcare Iowa website. I'm going to show you a couple places here. So on our website, if you go to our Healthy Childcare Iowa website, I'll go to the main page. It's part of the Iowa Department of Public Health website. And if you were looking for your local nurse consultant, here's where you would click on this. Here's our tabs for our site, and you could find a nurse consultant by clicking here, and it would give you the name and the contact information for your child care nurse consultant. And then the COVID section of the Healthy Childcare Iowa website is under the printed products area, which I know a lot of you are familiar with the printed products section of our website. And if you scroll down, you'll see.
Heidi?
Yes?
The screen did not change.
It didn't.
So we're not seeing the Healthy Childcare
I'm
website.
sorry. Let me see if I can switch it. I still have a screen, but it didn't catch up, huh? Brenda, is that you, or is somebody able to maybe share their screen? I'm going to stop share and then I'm going to try to share again, okay? Unless somebody else can share. Okay, let me try again here. Sorry, technical difficulties here. Thank you for letting me know that. Okay, are you able to see it now? You should be seeing our Healthy Childcare Iowa website here.
Yes, it's there now.
Okay, great. Thank you so much. I must have had a little glitch there. So I'll go back. Here's our main website. It's on the Iowa Department of Public Health website, and you can do a search for Healthy Childcare Iowa, or you can go directly to our site if you do a /IDPH.iowa.gov and a / with Healthy Childcare Iowa or HCCI. So this is where you would go to find a consultant. You can click there, and you would click on find a consultant, and you would get your consultant information there. And then the COVID resources page is on the printed products area. And I'll show that to you. Hopefully you're still seeing this. So if you scroll down to the COVID-19 section, this is where the child care centers and homes health and safety concerns document that I just reviewed is right here. There's also some really great resources on the Iowa Department of Public Health website, COVID-19 website, if you haven't been to that site. And the child care specific information has been linked from our site to that site. So there's kind of a list. There's some guidance for child care centers and homes that link will take you directly to the Department of Human Services guidance document. There's a fact sheet talking to children about COVID-19. We've just updated the public section. There's some information on the public section of the IDPH COVID-19 site. And there's quite a few documents there that are really helpful for providing information to parents and staff, and then also for some children, especially with addressing anxiety and working with children where there's concerns. Just added, the Iowa Poison Control Center did an alert related to a couple medications that I know people are, there's been some discussion about as a preventative method, taking a couple different medications, and there's a toxicity report about that. So if you've seen anything on social media about taking medication that hasn't been officially approved for COVID-19, I would direct you to that poison control alert. And then I just wanted to also share with you some additional resources. The Centers for Disease Control has some great helpful information on environmental cleaning. We have our link here to the Department of Human Services resources website for COVID-19. And then CCR&R has a great website with a lot of wonderful resources, as well as linking to our website, but resources related to business practices and questions and answers about, business issues. So that would be something if you haven't seen that, I would definitely recommend that you go to their website. I do want to show you, since I'm here, and then we'll maybe open it up for questions. Actually, I had one more thing I was going to share with you, and then we'll open it up for questions if that's okay. If we go to the main Iowa Department of Public Health website, on the main page is the information for COVID-19. So if you haven't seen that, that's great to you can look at the state map and look at our counties and how many cases there are by county. So there's a lot of great information in all of these tabs on the side here. One other thing that I did want to just share some information with you was related to cloth face masks. And I just wanted to show you on the IDPH website, there is some guidance or some information about homemade masks for making cloth face masks, and some guidance for the public on that. And I wanted to share with you, we've had this question come up just kind of over the weekend. The Centers for Disease Control made some recommendations about that in the general public, it would be beneficial to wear a cloth over your face, either by using a cloth mask or a handkerchief. And I wanted to just share some guidance related to childcare. So the question that has come up has been, should providers be wearing masks in childcare? Should childcare staff be wearing masks? Should children be wearing cloth masks in childcare? And I just wanted to let you know and be clear that the Centers for Disease Control did not add the wearing of cloth face masks to their guidance for children in childcare. So the Centers for Disease Control has a great information specific to schools and childcare on their website, and there's a handout and a fact sheet that's related to what a childcare who remains open should be doing to help with preventive measures for COVID-19. And that is really important for providers to understand that, yes, in the general public, and if people are going out and about for getting supplies or going to the grocery store and those kinds of essential things that we need to do, that the CDC has recommended using the cloth face mask, but that the CDC has not made that recommendation for children in care or staff in care. So I just wanted to be clear about that. That could change. Every day something changes. I'm going to be honest with you. Tomorrow we could come out with something different, but I wanted to let you know that guidance has not been added for the CDC for child care providers or for children. I did want to just put a little caveat in there about face masks. There is recommendations though when you're checking temperatures when children are coming into care, and if you're going to be checking those temperatures, that's required by DHS to monitor those for children coming into care every morning, that there is a recommendation on the CDC website that you wear a face mask as well as a gown and face shield. Now, I will be honest with you, that is going to be very difficult because those supplies are not available to the general public because they are being reserved. We are in shortage of those, and those are being reserved for healthcare workers. So if, for that situation, wearing a face mask And if you know, I know that the surgical masks and the N95 masks are being reserved for healthcare workers and for law enforcement and ambulance, and so a cloth face mask would be appropriate during those health monitoring daily screenings in the morning when you're admitting kids into care. And so the CDC does have that. The CDC also states that if available, if you have a child become ill while at care with a fever, cough, that while that child is waiting for their parent to arrive, if you have a mask that you can have the child wear, that would also be another recommendation by the Centers for Disease Control. So those are the only two instances where they have had in their guidance documents about wearing the cloth face mask. So, and I'm actually working on some information that I don't think we'll have a specific guidance document related to face masks, but we did share some information with our nurse consultants and DHS consultants and CCR&R, and I'm actually working on some information that hopefully can be shared with you guys about some great resources about the cloth masks and those questions. So I'm going to open it up for questions. Let me pull up my screen here and look if we have some chats or anybody that I know I had one question that had been sent to me prior to the to our Zoom meeting here, and it was from Clara Niemer, I think. She's a director at a St. Timothy Preschool and Childcare, and her question was related to, it says, if a center has closed, which they did, how do they determine when to reopen, and what are some guidelines to follow? And I would hope that, Clara, I think you're on, aren't you? Are you able to unmute? Was the information that I provided, that handout, is that going to help somewhat?
Somewhat. I mean, you know, it's like, when do we determine when do we open? Because yeah, I don't know. I mean, the Child Care Aware of America, the guidelines that they put out said if the school systems are closed in your area, the centers should be closed. So that's kind of, it's like I'm kind of taking that into consideration. Our schools are closed. Yeah, I just don't feel like there's been any guideline, and I think I'd be interested to know how many of us out there are closed, and who's planning to reopen and when.
I don't have a specific number, and maybe either Mary or Brenda has some specific information about how many have closed. I do know that we have had quite a few programs that closed because they were associated with a school district, so they closed right off the bat when schools closed. And I am aware that Child Care Aware put that statement out about child care closures related to if a school was closing, that child care would consider that. But that is really not the guidance that we have for our state. And I wanted to share that I am in communication with other kind of healthy childcare states, state coordinators. So I've been working with California, New Jersey, Washington, and Arizona, and we've been having some discussion back and forth in terms of guidelines for childcare specific, because it really hasn't been quite as clear as maybe we would have liked. But I know for our state, we really decided that that we needed childcare to because it is an essential service for our state, that we really wanted to have that availability for children to be safe in care. And we know that in childcare, that's the best place for them to be for safety. And so, you know, the guidance document, I think, you know, you would have to determine what's best for you and what's best for your community. But if you were considering opening and you had, if the 14 days had passed, for sure, And I know I've seen as far as 21 days that local public health have made recommendations about closure. If you've passed those, you may consider reopening. And I would reach out to your local public health office and ask for some assistance from them in terms of that guideline if you're considering reopening.
So the public health would help us determine if it's safe in our area to reopen?
They might have some information specific to your area that could give you some guidance. I will tell you, local public health, because if they haven't issued an order or made a recommendation for you to close, they will not give you a recommendation of when to reopen. I'm just going to be honest with you about that, because that is a regulatory decision, and it's really your agency, your business decision when you decided to close, because of you were following with what the school district is doing, and that you're deciding to reopen. But I do feel that local public health would have some guidance if you reached out to them and said, I'm considering reopening now that I've been closed for such and such a time, and they could give you some guidance on that. And then also your child care nurse consultant also.
Heidi.
Mm-hmm.
Okay, thank you.
Yeah, thanks.
Mary, I just want to put a plug in for what you're saying. We're posting on our website daily information that comes from the state on any closures or anything what the governor's office is recommending. I would recommend that you all follow those releases, and you're getting them as on email as well from our constant contact that Brenda sends out. We are working closely when we are working with programs on opening or deciding to close. Again, like Heidi said, work alongside your child care nurse consultant, public health, your child care resource and referral consultant. It's really going to be that business decision, your decision. So rely on those resources. And again, like Heidi sharing some great information, and that will help you make that right decision.
Thanks for that, Mary. Darla, I see your hand is raised. Are you able to unmute yourself and ask your question?
Yeah, Heidi, I have just been, I know we've been in correspondence, but I've had a lot of emails about temperature taking and the thermometer and all that. Can you just maybe summarize kind of where that's at? Because I'm constantly sending emails and updates about that.
Sure.
Thank you.
The temperature monitoring is somewhat of a challenge. You know, it would be great if all of us had the no-touch thermometers, and that was, I think, some of the challenges. I actually had reached out to the cohort that I work with from other states, because the American Academy of Pediatrics guidelines really were not what their recommendations for fever and for temperature monitoring was a little bit different than what the CDC was recommending. And so I actually am working with one of the nurse consultant coordinators who has reached out to AAP. She's actually on an American Academy of Pediatrics team for caring for our children, as well as the infectious disease manual. And so that question has already been put out in terms of in the past, American Academy of Pediatrics did not recommend the thermal scanners because there was some error that could happen with those, but the CDC has said really the no-touch thermal forehead scanners is great, because then you're not actually having to touch a child when they're doing screening coming in, and that's what's being used in the hospital setting. Most of our programs do not have those. Most of them have a digital thermometer that they can use orally or axillary, or they have a tympanic ear thermometer. And so if you're using either of those devices, that we're just staying across the board that it's 100.4 is what you're looking for fever, because that follows the Centers for Disease Control and the DHS recommendation that was posted for temperature monitoring. And then if you are using a digital thermometer, that the CDC recommends that you do an axillary instead of an oral, which, I mean, that makes complete sense if you're worried about a child having a concern about COVID condition, you would want to definitely have an axillary done rather than doing an oral and then cleaning it and then doing another oral between children. So those are two recommendations I know that are on the CDC website. And I'm wondering if I can share my screen again. I'm going to try to switch to that CDC guidance for childcare. So let me see if I can switch just real quick. And Darla, did that help answer some of those questions?
Yeah, I think it's been confusing because like one in the CDC COVID kit, it says about they recommend the ear thermometers or the tympanic thermometers, but then actually the no contact or thermoscans are even better yet.
Mm-hmm.
Yeah, so I think, and I see a lot of the providers on that I've sent emails to and have questions about that. So hopefully that clarifies it.
Okay.
Thank you.
I'm going to try to share my screen again and show you the Centers for Disease Control. And hopefully that just worked. So the CDC has a coronavirus COVID-19 site, and they have actually guidance for schools and child care programs. So it's specific to our programs. And on this yellow box area is where you'll see updated guidance, and there is a supplemental guidance for childcare programs that remain open. And that has some great information about childcare programs that are open and how you should, some of that monitoring of temperature and things like that. And if I remember correctly, Mary, if you're on, I think that CCR&R sent some information out in a DHS newsletter about that.
I believe you're right. Yes, and that would be on our resource page as well.
Okay, great. Thank you. Yeah, I thought I had seen you share that. So that's a really, just keep on checking the websites, CCR&R's website. I know CCR&R is doing a great job keeping their website up to date. Healthy Chapter Iowa, we're keeping our website up to date. And I know that IDPH COVID-19 is kept up to date. And so we're trying to just monitor the CDC guidance, on a daily basis so that we have everything current. Any other questions?
This is Brenda. I don't see any other questions in the chat, but if you have questions, I think you can unmute yourself and ask your question, or you can raise your virtual hand.
I was just looking for some clarification. So the only reason that we would be that a childcare program would have to close is if it's a governor's proclamation or a local health order, but otherwise it's up to us. So if an individual in the center says that they're being tested, we don't necessarily have to close until we get the results. We can stay open if that's our policy. Is that correct?
Well, a little bit, some correct, some not. So if you had a public health order to close or a recommendation due to community spread or a governor's proclamation, then you would be ordered to close and directed how long to close. But in a situation where someone has been tested and you're waiting for test results, they have symptoms of COVID-19, and so they would need to be self-isolating. They would have been told by their physician or local public health to self-isolate pending those results. And so you would need to then decide if you should implement a short-term closure rather than waiting for those test results to come back, kind of erring on the side of caution to do a short-term closure, like I said, for 2 to 5 days. By then you'll actually, hopefully you would have test results by then, so that would help. So does that make sense, Jeff?
Yes. So then the recommendation would be to close for that time while we wait for those results?
That would just be a guidance to help you make that decision. Okay. And like I said, you might have local public health tell you, and that would be, like I said, a recommendation rather than an order to short-term close while you're waiting for that decision.
Okay. Thank you.
Okay. Thanks. Good question.
This is Charlotte too. Feel free to open up and talk about other questions or concerns you might have. We have a lot of our CCR&R staff on the call today, and they can help answer those questions too, along with Heidi's.
Okay, I'm not seeing any other questions. Oh, there, I spoke to Angela. Wants to know advice for staff who are uncomfortable working currently.
I would also refer to the guidance document that's in this yellow square about the supplemental guidance. The CDC has really said that for staff that are that have pre-existing conditions, that are over age 65, that have concerns about possibly that they have a family member. I had a call about a home provider who had a family member who was undergoing chemo. Some of those risk factors in there, and that's when you would really want to talk with your staff about why are they feeling uncomfortable about working, and maybe it is best that they don't work because they would fall into those categories. And so we really want to protect those individuals that are working to know that it's okay for them to share with you their concerns, and to listen to those concerns and make a recommendation that maybe they need to be on a temporary leave, and then following your business protocol about that, because we do know that there are some situations where individuals would be either in that high risk group or would have some concerns about being a risk for exposure. I don't know, Mary, do you have any other guidance, or Brenda, about, I know you have some great resources for small business resources on your page also?
Yeah, definitely. I just put the link to our website on the chat box, and then you can scroll midway down on our main page of iowaccr.org and click, there's a box that says resources. When you click on that box, you can see all of the grants and loans and information that we're getting on a daily basis that you can access right there.
I'm going to pull that up real quick, okay?
Yeah, awesome.
Oops. Okay, are you able to see the CCR&R website?
Yes.
And you can see right on their main page, they have some great guidance for the COVID-19. And then I know that if you scroll down also, there's the resource that you can click on to go directly to a lot of resources. So there's some postings, like we say, it's almost been daily with some different guidance and things that have been coming out. So
sometimes by the hour.
Yeah, or on the hour. We really appreciate everybody working together to make sure that we have the most up-to-date information for providers out there.
Heidi, one of the questions that was down in the chat was about particular resources to talking with children, and we do have one of those on our website. So if you scroll down and click on that COVID resources one, then there is another link for, at the very bottom, educational online resources for kids. One of those is from, sorry, I just lost it. It's from Sesame Street, about supporting families and caring for each other. So that might be a resource you can use to talk to kids.
That's great. And also I know there's on the Iowa Department of Public Health website, there are a couple of guidance documents that we've linked from our site to theirs related to anxiety, and then specifically related to children. There also was, and I I'll be putting this on our website, and I think CCR&R will also too. I was talking with Bobby earlier today, and there's a resource from 0 to 3 about how to talk with children about concerns or fears they have about people having face masks on. So I think that just came out from 0 to 3 yesterday. So
that's a good lead in to the question from Karen. She's asking, how well do the cloth masks work?
I would just, I'm going to just read exactly what CDC says about cloth masks. They are not intended to protect the wearer, but may prevent the spread of virus from the wearer to others. So they're not the same as the N95 protective masks that hospital and medical personnel wear. They do offer some protection, and so that's why the CDC came out with that. The one thing I want to just share is if you're wearing a cloth mask or any kind of mask, I guess, out in the public, or if you're doing that, if you're able to do that during the daily health checks, is to make sure you're washing your hands before you put the mask on, and that you're washing your hands after you take your mask off. Okay. I know that's one thing that the CDC, I wanted to make sure that everybody was aware about that. Any other questions? I know we're getting kind of close. This has been really great. I hope this has been helpful.
I don't know that it's a question, but Angela's just saying that she's struggling to asking staff to continue to come to work every day, knowing that they are at risk. And I think everybody would agree with that it's a tough position to be in because families need childcare, but we know it's a higher risk situation with little kids that aren't necessarily as good at personal hygiene as the staff. So if anybody else has any words of encouragement, I just know you're not alone, Angela, in that struggle of asking people to keep coming every day.
I don't see any more questions. I do see that Sherry Kennedy did post a link here. So it's on our chat if you'd like to look at that social story and see if that might be helpful. And then I just wanted to, on behalf of CCR&R, thank everyone for joining us this afternoon. We have not only Heidi joining us, and thank you so much for leading and being our guest speaker today and giving out that information, very useful information to all our centers and homes out there. But also I want to thank those center directors, the staff, our home providers, our CCR&R workers out there, our nurse consultants. You guys have really stepped up and helped our home providers and centers, and just been a great resource for and keeping everybody both emotionally and mentally handling everything that's happening in this world, and writing your own environments and your working environment. So thank you everybody for joining us, and thanks for all the questions and the great information, Heidi, that you gave to each and every one of us. I think we probably all took back something from this meeting. We are going to have another meeting this evening, I believe 7 to 8. And there is, that should have also been sent out with your first constant contact. So if you want to let anybody else know that you know wasn't on tonight, this afternoon, about that meeting, that would be very helpful, I believe. So thanks again. Any other questions out there for anybody? Heidi, anything else you'd like to?
No, just thank you so much for asking me to take part today, and I look forward to this evening's presentation as well. And please reach out to me or to your local nurse consultant for questions. I so appreciate everybody working together to keep children healthy and safe in the state of Iowa.
All right, thank
Thank
you.
you, Heidi.
Thank you, Heidi.
All right.